Okay, so you've shared some really fascinating research with me about DBT, Dialectical Behavior Therapy. We've got article studies, even some of your personal notes, and I'm really sensing that this could be a game changer for you. It seems like you're really interested in kind of leveling up your emotional well-being. And DBT is more than just kind of like a trendy acronym, right? It's packed with these practical tools that anyone can use. Now, I know you're no stranger to personal growth, so we're going to go beyond just the basics of DBT. Today, our deep dive is about understanding like the how and the why, the real nuts and bolts of what makes this therapy so effective, and how it can kind of uniquely benefit you. Expert speaker is here with us to guide us through some of the key insights. When you first encountered DBT, what was it that struck you as unique compared to other therapies you've studied?
Well, what I find fascinating about DBT is this beautiful blend of acceptance and change. A lot of therapies focus on either changing your thoughts or behaviors, but DBT recognizes that true growth comes from embracing both. It's about accepting yourself and your emotions in the present moment, while also developing the skills to create positive change.
I can see how that would resonate with your interest in mindfulness and personal growth. This isn't about suppressing emotions, it's about becoming more skillful in how we respond to them.
Exactly. Think of DBT as a toolkit for building emotional resilience. Instead of getting swept away by difficult emotions, you develop the ability to observe them, understand their triggers, and choose healthier coping mechanisms.
Now, you've mentioned that DBT can be helpful for everyone, not just those who are facing mental health challenges. Can you elaborate on that a little? How could it benefit someone who's already functioning pretty well?
Well, I think we can all agree that life throws curveballs at everyone. Even if you're generally pretty well adjusted, there's always areas where you can enhance your emotional well-being. DBT provides a framework for navigating those inevitable challenges that we all face, whether it's relationship conflicts, work, stress, even just the daily frustrations of life. With more grace and resilience.
So it's like having a mental fitness regimen, training your emotional muscles to become stronger and more flexible.
That's a great analogy. And just like with physical fitness, consistency is key. It's not a quick fix. It's an ongoing practice of learning and refining these skills over time.
Okay, so let's unpack those skills a little bit further. You've shared some materials that outline these 4 core modules of DBT: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. These seem like really foundational pillars for building emotional intelligence. What stands out to you about how these modules work together?
I think the power is in how they interweave and build upon each other. Mindfulness forms the bedrock, helping you become aware of your thoughts, feelings, and sensations without judgment. And that awareness then fuels the other modules. Distress tolerance equips you to navigate those really intense moments without resorting to harmful behaviors. Emotion regulation empowers you to understand and manage your emotions more effectively. And interpersonal effectiveness helps you build healthier, more fulfilling relationships.
I see how each module plays a really crucial role, but let's get a little bit more specific. You highlighting several DBT techniques like diary cards and chain analysis. That seemed particularly relevant to your interest in self-awareness. Can you explain how those work?
Diary cards are a brilliant tool for increasing self-knowledge. Imagine tracking your emotions, your behaviors, any triggers throughout the day. This helps you identify patterns, understand your emotional landscape, and make those crucial connections between your thoughts, your feelings, and your actions. It's like becoming a detective of your own inner world.
It reminds me of that quote, "What gets measured gets managed." By bringing awareness to our emotions, we gain more power to influence them.
Precisely. And chain analysis takes that a step further. It's about analyzing the chain of events leading up to a problematic behavior. So you're not just understanding what you did, but why you did it, which allows you to intervene at different points in the chain and develop healthier coping mechanisms.
It's about breaking those automatic reactive patterns that often lead to negative consequences. I think that's where real change happens.
Exactly. And that's the power of DBT. It's not about blaming yourself for your emotions. It's about understanding them, accepting them, and then choosing more skillful responses.
I'm sensing that DBT could be incredibly empowering for you. It's about taking control of your emotional well-being, rather than feeling like you're at the mercy of your feelings.
You hit the nail on the head. DBT empowers you to become the architect of your own emotional landscape.
Before we move on to part 2, where we'll delve a little bit more into the history and application of DBT, I wanted to get your thoughts on one more thing. This concept of validation seems really central to DBT. How is it different from simply agreeing with someone's emotions? And how does it contribute to growth?
That's a great question. And it's a common misconception about validation. It's not about condoning every behavior or emotion. It's about communicating understanding and acceptance. Even when you don't fully agree with the other person's perspective, this creates a safe space for them to explore their emotions, to challenge their thoughts, and ultimately to make positive changes.
So it's about meeting people where they are, emotionally speaking, and offering them a supportive foundation from which to grow.
Exactly. It's about saying, I see you, I hear you, and even if I don't fully understand, I accept your experience as valid. And that kind of validation can be incredibly powerful.
Now that's something to ponder. How often do we truly feel seen and heard, even by those closest to us? I think this idea of validation, not just in therapy, but in our everyday interactions, has some really fascinating implications. We'll delve deeper into that in the next part. Welcome back. So we've been unpacking these core principles of DBT, and it's clear that this therapy is all about skillful action, right? Not just understanding your emotions, but learning how to navigate them effectively. But I'm kind of curious about the origins of DBT. Where did this innovative approach come from?
Well, DBT has a really fascinating history that speaks to its effectiveness. It was developed in the 1980s by a psychologist named Dr. Marsha Linehan. She was working with patients who were struggling with borderline personality disorder.
Yes, BPD.
Yeah.
We touched on that briefly in part one.
Right.
And you mentioned that Dr. Linehan's own experiences influenced her work. Can you tell us a little bit more about that?
Yeah, Dr. Linehan's story adds a really kind of deep layer, I think, to understanding DBT. She was very open about her own struggles with mental health, including a history of suicidal thoughts and self-harm, and this personal experience really fueled her passion to find more effective treatments for people who are experiencing intense emotional suffering.
It's really inspiring how she transformed her own pain into such a powerful force for healing others.
Absolutely. And her personal journey led her to draw inspiration from a seemingly unexpected source, Zen Buddhism.
Oh, wow. That's really interesting. It's not often that you see these ancient Eastern philosophies kind of intertwined with Western psychotherapy. How does Zen principles shape DBT?
Well, Dr. Linehan recognized the parallels between Zen practices and the skills that she was trying to teach her patients. Zen emphasizes mindfulness, acceptance, and finding balance amidst life's inevitable suffering, which are all core elements of DBT.
That's so fascinating how she bridged these two worlds,
Right.
treating a truly unique approach to therapy.
It's a testament to her innovative spirit. And it's important to remember that DBT emerged from a place of deep compassion and a relentless pursuit of effective treatments. You know, she wasn't satisfied with the status quo. She wanted to create something truly transformative for her patients.
And it seems that she succeeded. You mentioned earlier that DBT is now considered like a gold standard treatment for BPD. Can you elaborate on what makes it so effective?
I think DBT's effectiveness really comes from its multifaceted approach. It combines individual therapy, where you're working one-on-one with a therapist, with group skills training, where you're learning and practicing these core DBT skills in a supportive environment. And there's also phone coaching, which provides real-time support when you're facing challenges outside of therapy sessions.
Phone coaching, that's a really unique aspect. It's like having a DBT lifeline when you're in the midst of a really difficult situation.
Exactly. It acknowledges that life doesn't pause just because you're not in therapy. And so DBT aims to equip you with the skills to handle life's ups and downs, no matter where you are.
That's incredibly practical. Now, I understand that while DBT was initially developed for BPD, its applications have expanded far beyond that. What are some other areas where DBT is proving to be effective?
Yeah, DBT has shown really remarkable versatility. It's being used to help people with a wide range of challenges, including anxiety, depression, eating disorders, substance abuse, even chronic pain. And it's not just for individuals. There's DBT for couples, families, and even adolescents.
It's amazing how these principles can be adapted to different populations and settings. Is there like a common thread that runs through all of these applications?
At its core, DBT is about learning to manage intense emotions, improve interpersonal relationships, and cultivate a greater sense of self-awareness. And these are skills that benefit everyone, regardless of their specific challenges.
It seems like DBT is shifting from a niche therapy to a more mainstream approach to well-being.
That's a great observation. We're seeing DBT principles being integrated into schools, workplaces, even prisons. It's becoming recognized as a valuable tool for fostering emotional resilience and creating more supportive communities.
Now, that's a really powerful thought. DBT not just is individual healing, but as a catalyst for positive social change. We'll explore those broader implications a little bit more in part 3. But for now, I want to circle back to something you mentioned earlier, phone coaching. It seems so practical and relevant to our always connected world. Can you paint a picture for us of how that works in practice?
So imagine you're in the middle of a heated argument and you feel your anger escalating. Instead of reacting impulsively, you could reach out to your DBT therapist for a quick phone coaching session. They can help you apply those DBT skills in real time, guide you to use mindfulness to stress tolerance or interpersonal effectiveness to de-escalate the situation, and communicate more effectively.
It's almost like having a personal trainer for your emotions, there to support you when you need it most.
Exactly. And it's not just for crisis moments either. Phone coaching can be used to problem solve, practice skills, or just get support in navigating everyday challenges. It's about empowering you to use DBT in your real life, not just in the therapy room.
I love this idea of real-time support. It's so relevant to our fast-paced world. DBT seems to bridge the gap between theory and practice in a way that few therapies do. But I imagine that this level of support requires a very strong therapeutic relationship.
You're absolutely right. DBT emphasizes the importance of a collaborative and trusting relationship between the therapist and the client. The therapist isn't just an expert who's dictating techniques. They're a guide, a supporter, a partner in your journey toward greater emotional well-being.
That sense of partnership seems really crucial, especially when you're navigating those vulnerable moments of intense emotion. Now, before we wrap up part 2, I had one more question about the structure of DBT. You mentioned group skills training. What does that typically involve?
Group skills training is a really dynamic and interactive part of DBT. It's typically a weekly session where you meet with other individuals who are also learning DBT skills. The group setting provides a safe space to practice mindfulness exercises, role-play interpersonal effectiveness techniques, and learn from each other's experiences.
So it's like a DBT lab, where you can kind of experiment with these skills in a supportive environment.
That's a great way to put it. And the group dynamic is incredibly powerful. It fosters a sense of shared understanding and belonging, reminding you that you're not alone in your struggles.
That sense of connection is so important, especially when you're dealing with emotions that often feel very isolating.
Exactly. And it's not just about learning techniques, it's about building a community of support. The group becomes a source of encouragement, feedback, and inspiration as you navigate the ups and downs of your DBT journey.
Okay, so we've covered a lot of ground in our deep dive into DBT, from its unique blend of acceptance and change to its kind of versatile applications in all these different settings. But like any therapeutic approach, it's important to consider both sides of the coin, right? Are there any limitations to DBT that we should be aware of?
Well, while DBT offers these really powerful tools for transformation, it's really important to approach it with realistic expectations. You know, it's not a magic bullet. It's not a quick fix. DBT requires active engagement, commitment, and a willingness to challenge these deeply ingrained patterns. It's about building skills and practicing them consistently, just like you would if you're learning a new language or a musical instrument.
So it's more of a marathon than a sprint.
Exactly. And it's not always easy. You know, DBT asks you to confront uncomfortable truths about yourself, to sit with those really difficult emotions, and to push yourself beyond your comfort zone. And that can be challenging, even with the support of a skilled therapist.
I imagine it takes a certain level of self-awareness and motivation to truly benefit from DBT.
You're absolutely right. DBT isn't for everyone. It's a very highly structured and skills-based approach, which might not resonate with individuals who are seeking a more kind of exploratory or insight-oriented therapy. And it's not a substitute for addressing underlying medical or psychiatric conditions.
So it's really essential to find a therapeutic approach that aligns with your own individual needs and preferences. Now, for those who are intrigued by DBT and they want to explore it further, how can they go about finding qualified practitioners? What resources would you recommend?
Well, there are several really reputable sources for finding qualified DBT therapists. The behavioral tech website, which was founded by Marsha Linehan herself, has a directory of certified DBT therapists worldwide. And a lot of professional organizations, such as the British Association for Behavioral and Cognitive Psychotherapies, or BABCP. They also have directories of accredited therapists with specific DBT training.
So Dr. Linehan's legacy continues to guide people towards qualified practitioners, even beyond her groundbreaking work. And word of mouth can be valuable too, right? Talking to healthcare providers or mental health advocacy groups could lead to some good recommendations.
Absolutely. Don't underestimate the power of personal referrals. And with the rise of teletherapy, you know you have even more options. For accessing DBT services regardless of your location, just be sure to verify the therapist's credentials and their experience to make sure that they are qualified to provide DBT.
Excellent advice. It's so important to do your research and find a therapist who's a good fit for you. Now, let's kind of shift gears for a moment and consider those who might not be ready for formal therapy, but they're still curious about DBT. Are there any practical steps they can take to kind of dip their toes into these principles and maybe start integrating them into their daily lives?
Oh, absolutely. There are so many accessible ways to explore DBT principles on your own. Start with books. There are some fantastic workbooks out there, like the Dialectical Behavior Therapy Skills Workbook by McKay Wood and Brantley, which is packed with practical exercises and worksheets.
That sounds like a really great starting point. For people who want to kind of get hands-on with DBT skills, are there any other resources you'd suggest?
Guided meditations are a wonderful way to cultivate mindfulness, which is a core element of DBT. And there are countless apps and online resources that offer guided meditations for all sorts of different purposes, from stress reduction to emotional regulation to even improving sleep.
And of course, there's always the option of seeking out
Right.
DBT-informed workshops or online courses. A lot of organizations offer those programs. And they provide a really structured introduction to DBT principles and techniques.
Exactly. And don't underestimate the power of self-reflection. Simply becoming more aware of your emotional patterns, your triggers, and your typical reactions can be a really profound first step toward greater self-understanding.
Yeah, it's like shining a light on those automatic responses
Yep.
that often drive our behavior. That awareness in itself can be incredibly liberating. As we wrap up this deep dive, I'm really struck by the transformative potential of DBT. You could distill the essence of DBT, like a single takeaway for our listener. What would it be?
I think DBT is about empowering yourself to live a life that is both meaningful and fulfilling. Even amidst all of life's inevitable challenges, it's about cultivating that sense of balance, accepting yourself as you are, while also striving to grow and evolve.
That's beautifully said. DBT reminds us that we all possess the capacity for profound growth and healing. It's about equipping ourselves with the skills to navigate life's complexities with more awareness, resilience, and compassion for ourselves and for others. So as you continue your journey of self-discovery and personal growth, remember this: you are capable of creating a life worth living. And DBT offers a roadmap, a toolkit, a compassionate companion to guide you along the way. Happy diving.